Dear students, now we are going to see the details of this radio-ulnar joint. Radio-ulnar joint means between the radius and ulna. See here between the radius and ulna we are having three joints. See here in the upper part, superior radio-ulnar joint. Here in the lower part, inferior radio-ulnar joint. Then in between, see these shafts are connected by a membrane, interosseous membrane. Then we are considering as the third joint, middle radioulnar joint. Okay, so superior radioulnar joint, inferior radioulnar joint, then middle radioulnar joint. Here we are going to see the details of superior and inferior radioulnar joint. See, first one, superior radioulnar joint. It's a pivot variety of synovial joint. What is that pivot variety? Pivot variety is having one central axis. Around that, one osteoligamentous ring will be there. See like this. This is the central axis. This bone it acts as a central axis, and this is what the osteoligamentous ring. Say here, this radius acts as a central axis around that this ring. Okay, so like this type joints are known as pivot joint. So no doubt it's a pivot variety of synovial joint. Now what are the articular surfaces? See circumference of the head of the radius, okay, and a osteofibrous ring or osteoligamentous ring. That ring is formed by the radial notch of the ulna and annular ligament. We'll see that. See, I already told you this is what the ring. Okay, so here in the medial part we can see the ulna. So medial it is formed by the ulna. Which part of the ulna? This notch, radial notch of the ulna. This groove is known as radial notch. Why it is known as radial notch? It is for this radius. So this groove is known as radial notch. Okay, and laterally this ligament known as the annular ligament. You see, this is the annular ligament. This is the anterior view of the annular ligament. We can't see the posterior part, but here we can see this is the superior view, so we can see anterior part and the posterior part. Okay, so osteoligamentous or osteofibrous ring formed by the radial notch of the ulna and annular ligament, that is clear. Now circumference of the head of the radius. See this part, this is the head of the radius. It's periphery, not the superior surface. Here in this image we can see the superior surface, but not the superior surface. This periphery of the radius. See this periphery. This is the circumference or margin of the head of the radius. So the articular surfaces are clear. First type, it's a pivot variety of synovial joint. Second, articular surfaces. Okay, those 2 points are clear. Now what are the supporting factors? Okay, here also, see first one is a annular ligament. Annular ligament, now we know it's a ligament extending from the anterior margin of the radial notch. See, this is a radial notch of the ulna. This is a radial notch seen in the ulna. Okay, this is the anterior margin, and imagine this is a posterior margin of the radial notch. So this ligament extending from this anterior margin of the radial notch to the posterior margin of the radial notch. Now this ligament, it is known as the annular ligament. So first ligament, annular ligament. It is attached to the margins of the radial notch of ulna. It is correct. Now quadrate ligament. Quadrate ligament is a small ligament which extends from neck of the radius to the lower margin of the radial notch of the ulna. What is meant by that? See, this is the neck. See, head, then neck, then tuberosity of the radius. Those are the properties of upper end. Okay, so head, neck. So this ligament, this is a quadrate ligament extending from this neck to here comes the radial notch, lower margin of the radial notch. Okay, so this is small ligament, it is a quadrate ligament. Those are the two major ligaments of this joint, annular ligament and quadrate ligament. Now blood supply, no doubt, same like that of the elbow joint, anastomosis around the elbow joint. Okay, and now supply musculocutaneous nerve, median nerve and radial nerve, movements, supination and pronation. So what is meant by supination? What is meant by pronation? In a semi-flexed elbow, see this is a semi-flexed elbow, not a fully flexed elbow. It is semi-flexed elbow. If the hand or this is a palm, okay, if the palm is moving downward, it is known as pronation. In a semi-flexed elbow, if the palm is moving downward, such movements are known as what? Pronation. And this is a pronated arm. Okay, and this one, if in a semi-flexed elbow, if the palm is moving upward, it is known as supination, and it's a supinated upper limb. Okay, clear. So that is what the supination and pronation. Okay, so this movement. Okay, these are the two movements in this joint. Now, inferior radioulnar joint. Inferior radioulnar joint is also a pivot variety of synovial joint. What are the articular surfaces here? Head of the ulna articulate with the ulnar notch of the radius. See, here in the lower part of the ulna, we are having one head and one styloid process. See, this head which articulate with a notch here, the radius. This is the radius. That notch for the ulna. So that notch is known as what? Ulnar notch of the radius. Clear? So here ulnar notch, here head of the ulna. Okay, so head of the ulna articulate with the ulnar notch of the radius. Now here, what are the supporting factors? Capsule is here, it is covered with the capsule and articular disc. It is having another supporting factor, articular disc. It is almost triangular in shape. So it is having one apex and one base. Apex is connected to the styloid process, base of the styloid process. See here, in this image, this is the styloid process. Now this area, this is the base of the styloid process and this is the tip of the styloid process. So this is what the articular disc. So it is attached, apex is attached to this base of the styloid process. Now base is attached to this lower margin of the, say here, this depression is a ulnar notch. So lower margin of the ulnar notch. This is the head of the ulna. Okay, and here correspond to the head of the ulna. Here in the radius, there we can see a depression. That is what the ulnar notch of the radius. So towards the lower margin of the ulnar notch. Okay, let's say that. So apex is connected to the base of the styloid process, and the base of the articular disc is connected to lower margin of the ulnar notch. That's all. Those are the two important ligaments, capsule and articular disc. Now, blood supply, anterior and posterior interosseous artery. I told you the middle part, these two bones are connected by a membrane known as the interosseous membrane, and we are considering it as a third joint or the middle radioulnar joint that you have to read. Okay, so uh, the anterior aspect, there we can see one artery. That is what the anterior interosseous artery, posterior side of the interosseous membrane, posterior interosseous artery. Okay, then nerve supply, same anterior and posterior interosseous nerves, movement, supination and pronation. I not go to the details of the supination and pronation. Okay, so these are some of the important details of this radioulnar joint. Okay, what are the muscles? Muscles helping this movement. Okay, supinator muscle and pronator muscles. Okay, so the remaining details you have to read. Thank you.